Anything that irritates the gut and causes inflammation in the brain will lead to depressive and anxious type disorders.
Welcome to the What Up Doc University podcast, your number one resource for total body wellness. Here's your host, Dr. Mike.
Hey everybody, welcome to the What Up Doc University podcast. It's Dr. Mike here with another special guest. This time around, I want you guys to drop whatever you're doing and pick up a pen, paper, whatever you need to write something on and take some awesome notes on this call, because we're going to have the encyclopedia of nutritional research. His name is Mr. Tom Malterre. Tom, are you there?
Absolutely, Mike. So great to be with you.
Awesome, guys. Hey, Tom has a bachelor's degree and master's in nutrition from Bastyr University. He's a faculty member of the Autism Research Institute. He has an amazing website as well, called Whole Life Nutrition. He's a clinical nutritionist. Worked with actually one of my favorite companies that I use in my office every day, Thorne, and he did a TED talk on I guess people's most or least favorite vegetable, broccoli, and right, and Tom's going to talk to you all about that stuff today. Tom, great to have you on the call today.
Oh, Mike, it's such a pleasure. As you know, right, I ran across you years ago when I was teaching myself about ukulele, and I've been a fan ever since. So, yeah, it's so great to be on your show, man.
That's so funny, man. That's so funny when you mentioned that. I was like, whoa, how do people know that?
You're amazing, man. You're out there. It's great.
Thanks, man. So let's kick it off, man. Let's start with, I know you talk a lot about, your in your upcoming book, The Elimination Diet, you talk about the microbiome and the gut. And that's something that I'm really big on in my practice with patients is start with the gut. And if we can fix the gut, we can solve almost all of your issues. So let's start with that.
Absolutely. So, the microbiome is fascinating, right? What we're seeing pretty much for every disease now, Mike, is that there's these elements of what's called lack of biodiversity, meaning that when you have a lot of different organisms in and on your body, they seem to protect you. So, everybody's so paranoid, right? We're always, washing everything and sanitizing everything, right? And we're just like, oh, no, the germs. But it turns out what we're seeing is the exact opposite. We're seeing that when you are born in an environment where you have lots of different germs you're exposed to, right? Bugs you're exposed to, whether you're growing up on a farm or whether you're growing up in a big family or whether your parents actually clean your pacifier by sucking on it themselves versus washing it off underneath a faucet. All these things are incredibly protective for keeping someone's immune system calm. So, when you see a person with an overactive immune system, this is a person who has eczema, asthma, atopy, right? So they've got lots of skin problems, lung problems. They can't eat a lot of foods because they'll break out in some sort of allergy, hives, things. So it's their immune cells being confused because it turns out that the microbes in our environment, they're everywhere, right? I mean, they're 30,000 feet up in the air. They're deep in the oceans. They're everywhere. And it turns out these microbes are constantly talking to our bodies. They're constantly communicating with our cells. In fact, we have an entire system. We have an entire, what would be considered our sixth sense to talk to microbes. And this is called the microbial interaction system, which for some reason down the line has been labeled the immune system. But really what it is it's designed to be talking to parasites. It's designed to be talking to bacterium, fungus. It's supposed to be, communicating constantly, surveying the atmosphere around the body, in the body, and saying, all right, is this okay or is this not okay? Is our environment peaceful out there? Do we have lots of the good guys floating around, or are we missing some of them? Because when we're missing some of them, we know that those microbes will protect us from some of the harmful pathogenic organisms. We know that those microbes can break down a lot of our starches, a lot of our food particles for us. We know that those microbes will produce B vitamins, vitamin K. They'll produce things that are very protective for our body, different amino acids like tryptophan. Did you know? Bacterium produce tryptophan, they produce phenylalanine, they produce tyrosine, the things we need for normal neurological function, to make our neurotransmitters, our serotonin, our dopamine. So, the microbial interaction system knows. It knows that if you're missing certain microbes, then you need to be on a state of alert and alarm. You need to be very, very cautious, and you'll actually upregulate your response to proteins in the environment. You'll upregulate your response to pollen and dander and foods when you don't have adequate microbes around.
So when you're talking about adequate microbes and you're missing some, what are you specifically talking about there? Just for clarification for our listeners.
Yeah, absolutely. So, come on. We're oftentimes being born in sterile environments, right? So you are born in a hospital room that's been sanitized. Oftentimes people are doing lots of elective C-sections these days. And that's probably the most important exposure time you're ever going to get is birth.
Right.
So if you're coming through the vaginal canal, maybe the mom's head is pushing, the baby's head is pushing against mom's cecum. Maybe a little bit of the fecal matter might make it out. It's kind of a dirty process, the whole birthing thing, right?
Sure.
And that quote-unquote dirty process, it's actually kind of a clean dirty, but it's still dirty for a lot of people, is actually amazingly important for establishing this new infant's exposure to the outside world. They're supposed to be getting exposure via bacterium from mom a lot. And if they're not getting that exposure, then there are certain colonies that never really take hold in the body. And then after that, they're supposed to be breastfeeding. And if you breastfeed, then, there are certain starches in the milk. They're called human milk oligosaccharides. These certain starches in the milk that actually are undigested by the baby. They're not able to be used by the baby, even though they're the third most common mass in the breast milk. So then, what do they have to do? They have to be broken down by microbes. And they are very specific about feeding certain microbes. And then they can flourish. So if you have a C-section, if you're not breastfed, and then what often happens in hospital births or in young childhood these days in the United States is, you get a little ear infection, what does the doctor recommend? If you get a little tummy ache, what does the doctor recommend? If you get a sickness, what does the doctor recommend? They recommend antibiotics.
Yeah. And
it's now very clear that after every single course of antibiotics, you completely shift your microbiome, and it's never, ever, ever identically the same. So, you may be using too many. There's an entire book written on this called Missing Microbes by Dr. Martin Blaser. That's brilliant. Yeah, it just basically says, hey, what are we doing out there? We should really respect our bugs a little bit more, because when we do, we live happier and healthy lives. So when I say we're missing microbes, really, because of our sanitation, our water purification, whatever, we're now to a point of missing about 1/3 of the indigenous microbiome we would normally see if we were living out in the woods.
Wow,
so,
1/3.
1/3. Microbiologists have gone around the globe, and they're looking at mountain gorillas, and they're looking at indigenous cultures and whatnot. They're saying, look, up to 1/3, if you're in an industrialized society like the U.S., and you've had your antibiotics and you've been doing your sanitation and stuff, you're missing a lot of microbes. So, what does that manifest as? That manifests as a system that's kind of unstable, right? So I see this a lot in GI problems. I see a lot in gut irritation. I had one gentleman who went in for hernia surgery, and he had this hernia surgery, and then afterward he had this terrible diarrhea and stomach upset and cramping and everything, right? And so he took antibiotics to get rid of that, and he took antibiotics to get rid of that. And it's like, he took the antibiotics for the infection, which gave him the diarrhea, and then he took antibiotics to get rid of the diarrhea, which gave him more diarrhea. And it just went around this cycle, right?
Yeah.
And all this gentleman did was he just, got some material from our books on fermented vegetables and started eating sauerkraut every day. Sauerkraut. That's it. And so he started eating sauerkraut, and within a couple of weeks' time, boom, he was done. Gut was calm, everything was fine. So in his particular case, something magical in the sauerkraut, some missing microbes in the sauerkraut, helps his system find balance again. So this happens all the time. It's not just about gut problems. I see this with mood. I see this with joint pain. I see this with skin issues. Oftentimes if you can reintroduce beneficial species, if you can calm down the gut, oh my goodness, right? All of a sudden life is good.
Yeah, I see. I mean, if you just look at the statistics, in the healthcare aspect of what's the top leading causes of death, or even the top prescribed drugs, is always for some type of gastrointestinal thing. Um, and in my practice, I look a lot with the gut in its relation to the mind, the neurotransmitters and all that kind of stuff. And, the link of depression and, just that whole myriad of complexes. And a lot of, I guess, mainstream medical practitioners, or even just mainstream community in general, they don't see that connection. That how can my gut and its balance affect my thinking? Dive into a little bit about that.
Oh my gosh, you got to be kidding me, right? I know, it's so weird how they're just like, oh, the brain is here and the gut's there. There's two separate specialists. Go to a gastroenterologist, go to a neurologist. Two separate.
Yes.
It's not separate at all. Number one, you have innervation in the gut all the time that directly communicates to the brain. And number two, the gut's constantly producing things that you need for neurotransmitter function. So those aromatic amino acids that we talked about, tryptophan. Come on, tryptophan is like the least common amino acid that you're ever going to come in contact with. The more, the better. And basically, you need to convert that. So you're going to need some folates in order to do that. You need some background antioxidants in order to do that. You need a lot of different things coming from the gut just to make normal neurotransmitters. So yeah, that's number one. And then number two is people don't understand that oxidative stress, inflammation, those are the true causes of depression. Those are the true causes of anxiety. We're now seeing that chemical exposures, we're now seeing that microbe imbalances, we're now seeing food sensitivities. Anything that irritates the gut and causes inflammation in the brain will lead to depressive and anxious type disorders. In fact, that's a new definition. They're saying these are what's called redox imbalance or free radical rich environment imbalances, right? So not enough antioxidants in the brain, in essence, and inflammation associated disorders, so too much irritation in the brain, right? So you've got these problems that people don't associate, but they initiate in the gut. You have over 70% of your entire immune cell colonization is happening in the gut. If you want to cause inflammation, if you want to cause oxidative stress, it's easy. You just eat a bunch of foods that your body doesn't like, or you eat a bunch of microbes that your body doesn't like, and expose your quote-unquote microbial interaction system, your immune cells, which are concentrated in the gut because that's where the most microbes are. All you got to do is irritate those guys, and then they'll send chemical signals into the blood. What's the next stop from the blood, from the intestine? It's the liver. If you have inflammatory chemicals coming from the intestines to the liver, they'll excite the Kupffer cells, the immune cells in the liver. And then what's the next stop after circulation from the liver? It's the brain. So you go straight from the gut to the liver, excite the liver. Once the liver is excited, you go up to the brain. Once the liver-excited chemicals reach the blood-brain barrier, you permeate that barrier, you make it more open, and then all of a sudden you activate the immune cells in the brain called the microglia, and then boom, you know what? You've just turned on the glutamate excitatory process. You've thrown off a lot of things in the brain. You start having nerve cell death. There's all sorts of different things that contribute to depression, but really, depression starts in the gut. Look at comorbidities. Look at the disorders that you can have in the gut, things like, inflammatory bowel disease or irritable bowel syndrome. And you look at the comorbidities and you say, whoa, most of the time these people are depressed or anxious, and they usually have sleep issues as well. And you go, wow, there must be a connection, right? And you and I both know it's uncanny. My gosh, I put someone on an elimination diet, I give them some, neurotransmitter-based supplements, and depression just goes away. Anxiety can go away. Not on everybody, mind you, but my gosh, the vast majority of people, they're like, I never had any clue my food could be associated with my depression. I had no idea. And you're like, come on, the research is so clear. It's more potent, more of the times, if these people are choosing between pharmaceutical therapies where they're doing SSRIs or doing some benzodiazepines or whatever they're doing to modulate the mood, they can be on that for years and years and years. And then they'll go on these dietary changes, and within weeks, they feel better. Oftentimes, they're letting go of their medication. Oftentimes, the doctors are shocked. They're going, what? Like, What did you just do? Well, I just calmed down my gut, doc. Like, wow, So if people haven't tried that yet, I would say, my goodness, jump in, both feet.
Yeah, you talk about you mentioned the Elimination Diet, and that's your latest book coming out is about the Elimination Diet. Now, when people hear that, they don't necessarily know what that means, and they think that it's a diet like I'm gonna eat low fat or whatever. But explain a little bit more about the Elimination Diet, because this is one thing that I think a lot of people don't jump in towards as a first line therapy, and they just kind of it's often overlooked. So tell us a little bit about the Elimination Diet.
Yeah, absolutely. This is probably the most potent, important tool that somebody can utilize in clinical practice. When you're taught functional medicine, as we are, you just know that you remove certain foods from people's diet and they feel better. So if somebody comes in and they have joint problems, they have sinus problems, they have skin problems, the first thing I do is just say, hey, we really got to look at your food sensitivities. And I'm like, what? Food sensitivity? Wow, what are you talking about? Well, come on. If you are concerned about your immune cells overreacting, that's what causes the skin problems, the joint problems, the headaches. If you're concerned about your immune cells overreacting, how do you calm them down? Since the vast majority of immune cells in your body are in your gut, you calm your gut down.
Mm-hmm.
And what's happening in modern day society is because we've had this missing microbe epidemic, because many of us are exposed to too many chemicals, we're not eating enough antioxidant-rich foods, lots of green leafy vegetables, for example, getting our sun exposure, our vitamin D that would calm down our immune cells. Because we're not in an environment of calm most of the time, we're all stressed. We're running around eating crazy stuff and whatever. And next thing you know, right, our immune cells do not tolerate certain proteins in the environment. They're not going to tolerate, for people with allergies, some airborne stuff, and a lot of people, they don't tolerate food protein. So the chances, if you're going to have any interaction to excite your immune cells, the chances are that interaction is happening in the gut. So all the Elimination Diet does is it says, wait a second, okay, we went back hundreds of years, we looked at the research, and we said, you can have 100% of gallbladder, gallstone-associated diseases benefit from an elimination diet. You can have 90% of rheumatoid arthritis benefit. You can have 85% of migraines benefit. You can find 70% of ADD, ADHD. You can find 50% of skin-associated disorders that are non-allergenic, IgE-mediated. So you could say, whoa, wait, you can have a single intervention of removing certain reactive foods, and you can affect all those diseases? Yeah, and more. So the reality is the docs have been pointing this out. The functional medicine docs, the Alan Gabies of the world, the Jeff Blands of the world, they've seen this. Even Abram Hoffer and Leo Gallen, these guys have seen this for decades and decades and decades. If you take out certain foods, people's immune systems calm down. So the primary foods that people react to are the gluten and dairy. Those proteins are really funky. They kind of mimic bacterial structures. They're tough to break down. So if someone's going to have confusion in the intestinal tract and start reacting to a food, those are the king and queen right there. Absolutely. You take those out, I'd say 80% of the people, they just feel better. You just feel better. And maybe your disease doesn't disappear entirely, but oh my goodness, it gets so much better. You wonder, like, why am I not looking at this sooner? Like, why doesn't my doctor know about this? Right? So we just add in a few more things: gluten, dairy, eggs, yeast, corn, soy. Take out the top big dogs for a while. And if someone's been suffering from tremendous pain or skin issues or whatever, wow, stuff clears up. So that's all this is. We take out those inflammatory foods for a period of time, minimum 2 weeks. And you'll see in the program we're very selective as what we take out and what we add back in. And it's usually the less reactive foods we add back in first, and we hold off the big dogs a little longer. And then you leave those out of your diet for a little while. Once you leave them out of your diet, your symptoms start to go away. And once your symptoms are calm enough, then you can do your own experiment now. All we're doing is we're using your body as a lab. We're saying, all right, let's see, that's crazy. I don't know if I believe that guy, whatever. Let's see if I can take out certain foods and calm my symptoms down. And when you take out the food, your symptoms calm down. Then you add back the foods one by one and see who's responsible for irritating you. who's the one? Is it the corn? Is it the soy? Like, is it the gluten or is it the dairy? Are those the things that are exciting my immune cells and allowing me to experience something called a migraine or allowing me to experience something called rheumatoid arthritis? I'm not joking here, at all. The research is very clear in showing that migraines are likely just food-associated reactions, that rheumatoid arthritis is primarily a food-associated reaction. There are certain antibodies now that they're looking at called IgM antibodies in the intestinal tract, and they're tracing this entire disease to food reactions. So, this is not some weird, woo-woo stuff. There are hundreds upon hundreds of research papers looking at how elimination diets benefit people with inflammatory disorders. And even beyond that, there are hundreds of thousands, if not millions of cases in the United States alone where people who have gone on elimination-type diets and they've freed from symptoms. So, this is just tried and true, really, in the functional medicine world. It's been going around forever. So it's what I like to think of for people who have not heard of it before, the world's best-kept secret on how to feel better fast. So all we do is take out those foods for a period of time. In the interim, my wife has made these phenomenal recipes. They taste so amazing. Nobody's suffering. You just eat a bunch of good food for a couple of weeks, watch your symptoms go away, add back in food, see who's the problem food for you, and then you customize your own diet. This is not a long-term program. You see what foods are irritating you now. You take them out for a couple of months after you discover that they've irritated you, and then you wait to see how you feel. You can add them back in if you want or not if you want, depending on how you feel. But I'll tell you, most people feel so darn good after they've taken out whatever that problem food is. And for a lot of people, it's gluten. For some people, it's dairy. Some people, it's eggs. Once you take out that food or those 2 foods or 3 foods or whatever they are, leave them out for a while, your health just gets better and better and better. The skin clears up. The energy improves. Gallbladder disease, it's usually within 3 to 5 days. Migraines, it's within 3 to 5 days. Energy levels is usually within 11, 12 days. Weight loss happens almost immediately. My gosh, the average weight loss in the first couple of weeks is 7 to 10 pounds. So, if you just give your body some space not to be irritated at every meal, amazing things happen. That's all.
It's interesting you touched on the whole overweight, obesity thing, because that's a huge epidemic in our country that they don't really talk about, but they kind of put that on the back burner. It's just like, hey, we've accepted it. It's kind of there. The country's just getting larger and larger. That's just going to be the norm. We're gonna turn into the people from WALL-E. We're going to lie around all day long on a cruise ship.
Yep.
When you look at obesity, what have you been finding in the research saying, what's the link between food additives, genetically modified stuff, and all the just the processing of food? What's the link you've been finding there?
Yeah, well, it's fascinating because you started out like nailing it. The microbiome is behind everything, and what we're seeing now is there are certain strains of microbes in the system that respond to certain foods, and they'll send chemical signals to the liver, which will change how you metabolize sugar. It'll change how you store fat. So, in essence, the more you irritate your gut, the less you're going to have control of your weight. So you're either going to lose too much weight because you can't absorb nutrients and your gut is terribly, irritated, or you're going to irritate it just enough to send a signal to the liver. The liver says, I'm going to store fat. I'm not going to process blood sugar very well. So primarily, weight is controlled by gut health. This is very clear in the literature. And obesity, the epidemic, sure, fructose, high fructose corn syrup, for example, added to a bunch of foods and a lot of sugar added to a bunch of foods is going to cause you to gain weight. But we're now discovering the mechanism. And the mechanisms appear that these things interact with microbes. And that the high fructose corn syrup will interact with the microbes, will lead to a leaky gut and allow some of these microbes to sneak into your blood, cause inflammation. The body will protect itself, more and more fat, change its metabolism of blood sugar. So, yeah, it's the food additives, the chemicals, same thing. Interestingly enough, you're hearing about plasticizing agents, right? Another article just came out today showing that there's these little micro beads of plastic everywhere, right? And we're starting to see it in German beer. It's like, what? There's plastic in beer? What are you talking about? So these little chemicals in our environment and in the food packaging and in food additives and whatnot, they're called endocrine disrupting chemicals. And the endocrine system is what? It's your hormone system. And we're now seeing a lot of the pesticides in our foods, a lot of the plastics in our foods. They're disrupting hormones to a point of increasing the storage of fat. In fact, there's another name for these EDCs, or endocrine disrupting chemicals. Beautiful article written on this, by the way, in Environmental Health Perspective. They're called obesogens. Obesogens. Because they're literally associated with changing your hormonal function, your blood sugar metabolism, and your fat storage so much that they contribute to people becoming obese. Wow. So we look at all these things in our environment and we say, all right, we've got so much sugar consumption and the sugar is terrible. That might increase diabetes by 1.4 times, that might be something. Some of the data we're seeing on some of these chemicals altering blood sugar metabolism, they're increasing your rates of risk or of disease by, 20 plus times, 24, 26, 28 times in one study. So it's like, what? How is that even possible? Now, most studies are showing, it's 2 to 4 times or whatnot, but there's a couple of studies just looked at specific endocrine disrupting chemicals, and they saw, 20 plus times increased risk for diabetes. So that's profound, man. We really have to pay attention to the chemicals. So I think you're spot on for considering that, eating clean foods, eating foods that don't have extra pesticides in them. And when you mention GMOs, you just have to think GMOs are a delivery system for pesticides. They're either a pesticide themselves or they're doused in herbicide, the glyphosate, which the World Health Organization, I don't know if you saw that just a couple of days back, came back and said, we're wondering this may be a carcinogen, this glyphosate, this Roundup that, everybody's been freely using on their lawns and everything for years and decades. And the chemical companies are saying it's so safe you can drink it. Well, they were sued about that statement and lost. But now we're seeing it's a potential carcinogen according to the World Health Organization. So it's like, oh my gosh, we have no idea what we're doing with all this synthetic stuff. We have no idea what we're doing with producing all these plastics. And now, as a result, there's a lot of people who have extra weight and they have no idea why. And there's a lot of people who are walking around saying, what do I do? Do I have to rely on more synthetic chemicals? Am I supposed to get my drugs to take, on a daily basis? Should I be on these 4 to 6 to 9 medications? The average person who comes in my practice over the age of 40 is on 6 meds. So it's like, are those meds taking care of your problem, or are they causing more side effects which cause you to take more meds? So you just have to start asking these questions, right? And it looks like dietary intervention, doing a very, brief stint of your entire life, a couple of weeks of your entire life, removing specific foods that may be irritating your body, that's nothing. That's nothing in comparison to suffering for 10 years and being on a ton of medications, and all of a sudden your energy's gone and your memory's gone and you're type 2 diabetic. It's really nothing.
So why do you think that people don't take that route? It's like the information is out there. People know that. So why are people just being like, hey, you know what? I don't feel well. I'm gaining weight. My blood sugar's off. I'm tired. My joints hurt.
It's our brains, man.
Yeah, I'm going to go to my medical doctor and just get 10 drugs.
Yeah, man. It's the brain. It's the total brain. So, the issue that we're having is that, the brain, someone says to themselves, I'm going to suffer. This is the worst thing ever. I can't believe someone's suggesting I don't take away my beer, my bread, or my nachos, and my cheese, and my grilled cheese. That's just ridiculous. I could never live without that. That's just, I hear that all the time. Don't take away my milk. I'm like, look, I'm not taking away anything. I'm telling you how to take away your symptoms. I'm saying if you want to be free of your pain, if you want to have a different life, if you want to have more energy, that's your option. It's up to you. If you think the drugs are working for you, by all means, do it. If you're doing whatever you're doing right now and you're happy about it, great, keep going. But if you think there's another level and you think there's some way you can intervene to reach that level, why wouldn't you try it? Just for a couple of weeks, why don't you just jump in? Drop the idea that you're suffering and it's prison for you to let go of bread and cheese. It may be prison and suffering for you being on arthritis meds and constantly being on a 6 out of 10 pain scale or 9 out of 10 pain scale, or all of a sudden you have these crazy bowel attacks that you have to run to the restroom and you're a prisoner to the toilet. That seems to be more restrictive to me. The chronic low back pain, the migraines. So many people are suffering 1 to 3 migraines a week. That's not normal. You're not supposed to be tired after you eat. That's not normal. You're not supposed to have 4 to 6 bowel movements a day. That's not normal. So, people just don't understand. They don't understand there's something else out there. So all this is another option. And I just encourage people, look, try it or deny it. Like, you're going to sit there forever and you're going to go, all right, yeah, that never worked. I could never do it, whatever. You don't know that. You're either going to try it or you're going to deny it. So, do it or die wondering, right? We used to always say that when we were surfing or skateboarding, right, as kids. And how about you? Like, do it or die wondering, right? So you either go out there on that big day and you see if you can do it, right? Or you're going to die wondering, saying, well, maybe, I wonder if I could have hit that. I could have really dropped in on that. It would have been a beautiful ride. It would have been amazing, but no, it's too big. No, too big for this. Man, I really wish I would have, you know what I mean? Like, you're either going to go for it or you're going to die wondering, like, maybe my life could have been different if I gave it a shot. And it's not that difficult. It's not that difficult, man. We've got the program set up. We've got recipes. We've got all sorts of stuff. So if people want to give it a shot, we've got the tools for you.
Cool. Now, you mentioned a little bit about food allergies, and I know that a lot of people get the terms confused, and then they say, well, I'm allergic to this, but it's really a sensitivity versus an intolerance, and kind of explain what's the difference between those terms, allergies, sensitivities, and intolerances.
Yeah, great. Excellent question. So, the reality is most people consider an allergy something called an IgE-mediated reaction, meaning you have certain immune cells, certain microbial interaction cells, they're called the immunoglobulin class E cells, that will produce these antibodies, and you will actually have an attack against that particular substance that you produced antibodies to. So these antibodies, the IgE antibodies that you're producing, will attach to certain types of foods and normally create what's called a histamine response. So you'll get the redness, you'll get the swelling. Maybe if it's happening in the mouth, you'll get the swelling in the mouth or hives or sores in the mouth or on the skin. Or you'll have respiratory issues. Your breathing rate goes up, as well as it closes off and you can't get enough oxygen in. And so you'll end up with this life-threatening issue. So everybody knows about the allergies, right? So you need the EpiPen to calm it down, right? So IgE-associated allergy, that's normally what an allergy is. But to be honest with you, Mike, the progressive allergists these days, immunologists these days, they're like, that's bunk. That's totally bunk. Like an allergy should be considered any immune excitation whatsoever from a food. So if you have IgM, IgD, IgG, that should be considered an allergy. So there should be a new definition according to a lot of the progressive doctors out there. And they'll say, no, if you have immune excitation, your immune cells look at that food and they say, hey, man, that shape looks an awful lot like a bacterium or a virus or something. I'm gonna create a response against it. They'd say that's an allergy. A sensitivity or has been defined as something other than an IgE-mediated reaction. But I don't know. I think that kind of whole idea of sensitivity should be a broad spectrum viewpoint of you are sensitive to a food. You have some sort of sensitivity reaction. The intolerance basically means, hey, I can't tolerate this. I don't metabolize this well. I don't usually produce enough of the ingredients that my body would allow me to tolerate this. So I'd say the most common example is lactose. The sugar lactose. It's a disaccharide lactose. And if you don't break that down into the individual sugars and allow for the absorption of those into the body, they can build up and draw fluid out of your gut and give you diarrhea and gas, nausea, bloating. They'll feed organisms in the intestinal tract. If you don't break them down, the organisms break them down for you. So you end up with this cramping and terrible symptoms after you consume a lot of dairy products, right? Well, the only problem that you have there is you don't tolerate that particular sugar. You're not having a direct immune response to it, but you don't break it down, so the microbes break it down for you, and they cause the gas and the cramping. Or you don't break it down, and your body tries to flush it out of the system, causing the diarrhea by releasing a lot of fluid. So it's kind of an irritation to the body, but it's not exciting your immune cells. It's an exciting reaction from microbes and from the release of water to flush it out. So it's not necessarily what would be considered an allergy per se. So the intolerance thing, can happen in the form of lactose intolerance because you don't have enough beneficial microbes to help you with starch breakdown, or because your intestinal tract is damaged. People don't realize that the disaccharidase enzymes, they're formed right on the very tip of your intestinal cells, the microvilli, the brush border.
Mm-hmm.
And if you damage that brush border by, eating a bunch of terrible foods full of chemicals, or you're having a lot of gluten, for example, that's damaging your gut. In some people, my gosh, you start damaging the gut, you start damaging the secretion of these disaccharidase enzymes, and you can't break apart lactose. Or you could have a genetic issue. In autistic kids, for example, we see more of the kids don't produce enough of these disaccharidase enzymes, and therefore they can have an issue. So it's basically, you don't tolerate it. You don't form something in your body that allows you to process that well, and then it builds up somewhere in the system and causes irritation.
You mentioned about autism, and you're on the faculty at the Autism Research. What are you guys seeing in, we're seeing a huge increase in numbers, but what are you guys seeing as some of the causative factors and any type of interactions for this to start to precipitate?
Yeah, well, that's great, Mike. The concern out there is that so many people are looking for the cause of autism.
Mm-hmm.
They're trying to say that this is a genetic predisposition. It forms in utero.
Sure.
Nonsense. Absolute nonsense. So, yeah, there's great genetic data out there, but it doesn't answer all the questions. I was just listening to Paul Offit lecture. He's a vaccine expert guy. He was just saying, the vaccinations couldn't cause autism because autism happens in utero. And, there are some contributing factors that definitely help shape the environment for autism to occur in a kid, but it's not predisposed. Defined, I should say. Mm-hmm. They will be more likely to react to environmental stimuli that can push them over the threshold into autism. So one of my colleagues, Dr. Martha Herbert, she's a brilliant neurologist from Harvard University, she says, look, stop looking at the cause. She said, look at the contributors. She said this is an allostatic disease, much like all disease is an allostatic disease, meaning, you start putting irritants onto a balance scale,
mm-hmm.
and if you reach a certain point of irritants on the scale and you don't have enough nutrients, you push a child into a state of dis-ease. So if that child has a genetic predisposition, if that child has environmental exposures in utero, then they're going to be more susceptible to air pollution, to pesticides, to plasticizing agents, these endocrine disrupting chemicals we talked about before, and that might push them into disease more readily. Heavy metals in some children are more susceptible. So you say whatever their environmental exposure is, they're not able to tolerate it now.
Yeah.
But it doesn't necessarily begin in utero. That's been argued very brilliantly. I mean, anybody follows Martha's work. It's not somebody to reckon with when it comes to research. She has entire teams of people she works with. And my gosh, it's turning out it's an environmental condition. And the reason now the hypothesis is that we're rising so terribly quickly, right, at 28% increase in 2 years' time, is that the environment is changing quickly. We're having hundreds of millions of pounds, if not billions, of different classes of chemicals being introduced every single year into our environment. We have all these amazing companies out here, the Monsantos, the Syngentas, the Dows of the world, who are producing incredible profit by manufacturing increased rates of, plasticizing agents for the plastic bottles or the lining of cans or receipts. And we're also doing lots of herbicides, pesticides, fungicides. We're doing all these chemicals and we're spewing them out into our environment. We're up to now, Mike, I don't know if you've heard this number, but this is American Academy of Pediatrics. We're up to 74 billion pounds of chemicals being imported or produced in the United States every single day. So while the profits are every single day, that's not a typo. I'll send you that article. It was 2011 American Academy of Pediatrics. It was basically a warning that, guys, the vast majority of these chemicals are not properly safety tested for kids and pregnant women, and we're just doubting the world in this stuff, and we have to expect we're going to see an increase of these conditions. So fascinating, right? I mean, everybody's looking at a single cause, and I don't think it is. I think it's our environment. I think, the entire system is becoming inhospitable.
Yeah. Because I know surrounding the whole autism debate, you obviously throw in the whole vaccine debate, and then, and especially with what just recently happened in California, over here in Disneyland with the measles outbreak, and, you got people that are very, you need to get vaccinated or, you're going to kill the world. And then you got the other aspect where they're just like, well, vaccines is the Antichrist and, all that kind of stuff. Talk a little bit about that.
Well, they both have genius. I mean, yeah, sure. I mean, we don't want a bunch of people dying from infectious diseases. Absolutely. Sure, yeah. But no one's died from that outbreak. I mean, there have been deaths from measles in the last 10 years. So, and then you look prior to that in the 1960s, and you say how many actual people died when there was millions of cases of measles, and they were in the hundreds. It was in the 200 to 400 range, depending on what data you look at. So, is it as deadly as we're being told right now by the CDC and Paul Offit? No, I don't see that backed by scientific literature at all. In fact, I looked at one of the CDC bulletins the other day, and I was like, where are they getting that data? I'm like, I can prove that wrong. So I don't know if we need to get all excited about it. I think the fear factor can be kind of dangerous in itself. And I think what we're concerned about is that they're going to start taking the rights away of both parents, children, and of adults. I mean, the next phase is there's measures being introduced in the Senate to actually force vaccines on adults so they keep up with their schemes of what do they call the schedules? Schedules of vaccinations. So the problem is, Mike, some of these are great, and they're going to keep some great diseases down, and some of these have not been proven to be as safe or effective as we're being told. I just douse into the literature, and I look at some of the data, and I see some weak spots, and I kind of go, why are these being touted as being, very, very, very low risk in some cases? The HPV is one of the riskiest vaccines I've ever seen, one of the most expensive and riskiest. And it's never been, according to the data I'm looking at, and please prove me wrong. I mean, I'm always learning, but I'm also, talking to researchers directly, and I say, I don't know. I mean, there's some weak spots. I don't see the safety and efficacy. I don't see the trials going on long enough to prove that they're as effective as we're being told they are. So I just question what's happening right now. There's this massive load of media saying, hey, this is perfectly safe, this is perfectly fine. And I look at the research and I say, there's some issues in the brain that might occur as a side effect. There's some problems here. There are some susceptible populations who have mitochondrial disorders and whatnot that might be more susceptible, and they get washed out in a lot of the epidemiological research. So I've seen numerous people in clinical practice and elsewhere at conferences who have filed cases for vaccine injury in one, and they're part of research studies and whatnot. So there is another side of the story that exists that I don't think is being told as well as it needs to be told right now. So, I don't know. I hope there's some balance somewhere. And on the other end of the spectrum, no, vaccines aren't causing all of this stuff. I mean, it's not. You can't look at. You have to say that it's like Martha says. It's an allostatic load. Disease is always an allostatic load, like death from measles, for example. Mm-hmm. The people who are dying from measles aren't usually dying just because of measles infections. They're dying because they had a system that was weak to begin with. They were living in poverty. They didn't have enough vitamin A, vitamin D, whatever, their immune system was weak, whatever. If you look at the cases of death, I mean, there's usually some other predisposition going on. It's not usually just the measles. It was a measles in a weak system. So it's the same thing with the vaccines. You say, is it the vaccines that's causing autism? You say, well, come on. No, you can't say that it's the sole cause of that. That's ridiculous. What you can say is that it may be a potential contributor in a person who's had environmental exposures previously, in a person who's had genetic susceptibility, in a person who is under mitochondrial stress in that moment, has had an infection recently. There's so many different factors involved. You can't just say in isolation vaccines cause autism. But you can say it's a potential contributor in a very susceptible individual. And that particular argument, I don't think is being told anywhere. So that's unfortunate because it's true.
So very true. I mean, I'm seeing especially living in Southern California, I see both sides of it. It's a heated debate. You get the letters coming back from my son's school saying, "Hey, you know what? There's a measles outbreak, and you got to get all your vaccinations up to par." And all of this, it looks very just scary propaganda on the outside of it all. And it's like as soon as you step up to question and say, well, what's behind it all? And what can you do on a natural aspect to kind of prevent all of this stuff going on? It's kind of like you get this death stare, and be like, well, why are you even wanting to protect your child in that way? And it's just, are you guys seeing that up in the Pacific Northwest? Is this kind of...
It's all over the place. It's happening around the globe, and it's uncanny. Like, how is it that this one outbreak in California kind of flipped the switch on the international discussion about this? Like, I'm an author, and I try and promote my book or whatever else I try and do, and I notice how hard it is. You have to buy media. You have to buy public relations, right? Mm-hmm. So I wonder, how is it that this topic has gotten so immersed in the media as much as it has? How has it spread across the world like wildfire? How is it that every single, politician is now being lobbied very intensely to pass certain, I would say, bills that would be related to this? Is this an accident? And you mentioned an interesting word. You said it almost feels like it's propaganda. I don't know. All I know is that it takes money to make ideas happen in this society. Sure. So is there something behind this? I mean, who's paying the lobbyists who are showing up all of a sudden at all these, meetings across the globe? Like, where's this coming from? I don't know, man. I have no idea. I can speculate, but I don't think that would be fair. I would say just something's going on. That's all.
Yeah. There's something going on behind every single aspect. And I think the one thing is that people get too wrapped up in the big picture of it all, and they lose focus on what's right in front of them, where, take care of your own circle first, and then it'll spread elsewhere. So kind of like with that said, what would be your advice on, or for our average listener, on kind of taking steps forward to increase their health? What would be your, top 3 things that you would say, hey, you're sick, you're not feeling well, here's where you start. Give them the top 3 things.
I got it. You bet.
Got it.
First things first, we always learn this in functional medicine. You got to get rid of irritants. So, less irritants, more nutrients. And the primary thing that I'm seeing in people's lives right now, the primary exposure they're going to have in their environment to irritants will be from their food. Whether it's going to be the chemicals in the food, whether it's going to be the food proteins themselves, someone's reacting to gluten or dairy, for example, then if you get rid of those irritants, you're fighting less of an uphill battle. You can start leveling the playing field, if you will. Dr. Mark Hyman, I learned from him in 2007, and he said, look, to a room full of physicians, right? I had someone from Stanford on my left and another person on my right. And I'm sitting there, and this guy comes up, and young doc, and he says to the whole room, he says, look, you guys don't have a nutritionist in your clinical practices. You're not practicing medicine. And everybody's like, what? And then he says, look, I put all my clients, my patients, through my nutritionist first. I put them on Elimination Diet, and they get so much better. They get so much better. 80% of the symptoms dissipate enough to a point where I can fine-tune and get to the root of what's going on. But if I don't find out their food sensitivities first, there's too much inflammation. I don't know what's causing it. He says, you got to get to the root of that inflammation in the gut first. So he recommends the Elimination Diet. I recommend the Elimination Diet first. So take away the food sensitivities. You're fighting less of an uphill battle. Second to that, there are 2 miraculous nutrients that you need in your life, or I should say nutrient sources that you need in your life to balance out health more than anything else. One is the cruciferous family of vegetables. So that's where we get into my TED Talk. We get into broccoli. We get into broccoli sprouts, and we say, nothing ramps up your antioxidant, your detoxification function better than these cruciferous vegetables. So if you can get in some, half cup or quarter cup of broccoli sprouts a day, if you can get in some broccoli, cauliflower, cabbage, kale, Brussels sprouts, arugula grows really nicely in California. Some of these vegetables that really ramp up your detoxification systems, your antioxidant systems for 90 plus hours. So, it's better than orange juice or blueberries. I mean, they ramp up your system's ability to combat toxins, excrete more pollution in your urine, to make sure you protect yourself from cancer, from depression, all sorts of different things. So the cruciferous vegetables, yes. Try and get a serving or two a day. It would be great, at least 5 servings a week. And then, the last thing would be let's get some sun. A lot of people out there are really paranoid about skin cancer, and for good reason. You don't want to fry your skin. But at the same time, we want to make sure that you get a light darkening of your skin after you go out in the sun. So if you're Caucasian, usually that's after 10 to 15 minutes. If you've got olive tone skin, then that's going to be, maybe the 30, 45 minutes. If you're African American, that might be an hour and 20 minutes. And you need that sun exposure to form more vitamin D. And if you're not able to get that sun exposure, you may want to consider supplementation of vitamin D, because we're now finding this is one of the most potent immune modulating substances on the planet. And we're seeing a decreased risk for cardiovascular disease and many cancers and whatnot. So the one exception about the vitamin D, though, is, of course, if you're going to take high-dose vitamin D or get lots of sun exposure, you may want to make sure that you're getting adequate K2. And we're seeing in some of the literature, where people ramp up their D and they ramp up their calcium, they end up with more calcified arteries, so too much calcium in the system, right? And the one way around that that's been really well documented for the last decade is that if you have adequate vitamin K, you will not calcify those soft tissues. So taking some vitamin K2 with your vitamin D supplementation, taking some vitamin K2 if you're getting a ton of sun exposure, making sure you're eating lots of green leafy vegetables, hopefully converting into K2 with a healthy microbiome in your gut. So, I would say food sensitivities, cruciferous vegetables, sun exposure. There you go.
Well, what's your recommendation for vitamin D levels if they're not getting sunlight and they're just going straight supplementation?
Yeah, there's a great resource for this. Carol Bagerly, I started going to her conferences in 2009. She's wonderful. She's UCSD down there, right? So she has something called grassrootshealth.org. And Grassroots Health has this beautiful chart. And the chart basically shoots for people getting in the 40 to 60 nanogram per ml range. So she on that website basically breaks it down to tell you exactly how much supplementation you need and how long it will take you to get to that particular level. So she has a wonderful resource there at grassrootshealth.org. So I'll turn that question over to her.
Awesome. One last thing. Outside of your upcoming book, The Elimination Diet, what would be your one book that you would recommend our readers to listen or read?
Especially because of what's going on with the measles and stuff in California, I would say The Epidemic of Absence.
Ooh.
And the reality is, Epidemic of Absence kind of really changes our mindset about exposures to parasites, exposures to microbes. And it basically talks about how evolution has occurred, right? We formed these entire systems, these microbial interaction systems, to be able to train us. And when we're missing these childhood exposures of varicella or pertussis, things like chickenpox and whooping cough, then, we may be shifting how we develop our immune systems for the rest of our lives. So, I'm not against vaccinations at all. I think there's a lot of protection level there, especially in populations who are very weak or malnourished, and that's definitely a consideration. But I don't think we can throw the baby out with the bathwater. I don't think we can say that by altering immune cell communication, contact early in life, that we're not manipulating what nature had intended.
Yeah.
So, the Epidemic of Absence just kind of opens our minds that, wait a second, there's this very finite relationship, very beautiful, natural evolutionary relationship that has occurred over time. And it's not really about the infectious diseases. It's more about the parasite, more about the bacterium and how they increase our risk for disease when they're gone. And it talks about what we're doing in our society to sanitize and get rid of everything. And it basically makes you stop and think, like, whoa, like, who was here first? The microbes are here. Like, maybe we're carriers for the microbes instead of the other way around. It's fascinating. It's just a fascinating, extremely well-written, investigative book, Epidemic of Absence. Check it out.
Cool. Where can people find more information about you, and where can they get the book, and when can they get it?
Absolutely. WholeLifeNutrition.net, WholeLifeNutrition.net. And basically, you can just pop on the site. There's pre-order stuff for the book right there. And if you do pre-order the book on our site, my wife has put together an amazing cookbook full of recipes. They're absolutely free. So just pre-order the book, enter your order number, and you can get that cookbook there. It's great, and a quick start guide. And then, come and sign up for our newsletter. We're sending out all sorts of, crazy new research. I mean, I'm reading articles every single day. I'm plugged in. I don't own a television, so I don't watch TV. I just read articles. And if you want to learn about some of the trends that are coming up in the science and hear some really cool case studies from clinical practices for both me and the physicians that I work with, I run these things called progressive practitioner coaching programs where I teach doctors about functional medicine online. So we talk about all the new science and the case studies. It's pretty fantastic. So, if you want to plug into that, just go to WholeLifeNutrition.net and sign up for our newsletter.
Perfect. Well, thank you so much for being on the show today and sharing with us all of your knowledge, man.
Oh, Mike, my absolute pleasure, man. I'm just learning, just like every day. I interview docs and I try and learn what I can. And the whole reason, my friend, is because it seems as though nature's wise. It seems as though we can step back from our intelligence sometimes and trying to figure it all out and be part of it. We can eat organic, natural foods. We can get some more sunshine. We can actually have health because of that. We don't have to manipulate as much as we think we do. And I think we can live healthier lives because of it. So I think it's time to get rid of unnecessary suffering and get people happy again, huh?
Cool. There you have it, guys. Listen to Mother Nature.